Once again, we have Beatrice speaking with us this morning, who's a PhD candidate there at the State University of Maringá and has been collaborating with us for a little while now at Gemini. And she's going to tell us about her PhD project, which is about the perceptions of university students regarding sexually transmitted infections. So take it away, Beatrice.
Thank you, Ashley. Good morning, everyone. I'm so glad to be here today. I am Beatriz Souza da Fonseca, and today I'm going to present my project intituled Knowledge, Attitudes, and Practices of University Students about Sexually Transmitted Infections. The idea of this project came from my master dissertation when I studied with young people living with HIV, and we found an important lack of sex education, and we choose to think about this theme in university environment. So I'd like to introduce this work. The human body undergoes complex and rhythmic physiological changes throughout life. Sexual maturation involves biological, morphological, and psychological transformation. These changes lead to development of primary and secondary sexual characteristics, and the primary begins in the embryonic environment, and the secondary in puberty. So the adolescence and youth are defined by intense personal and social transformations, and this stage includes the search for individual identity and unique social experiences. World Health Organization defines adolescents 10 to 19 years and young adults 20 to 24 years. So, in adolescence, brain undergoes key changes, notably in the prefrontal cortex. In this area, controls impulses and decision-making, but is still in development. In mature regulation, increases susceptibility to risk-taking behavior, and because of that, adolescents may adopt health risks behaviors, HRBs, due to ongoing brain development, environmental influences, and lack of accurate information. These HRBs include actions that may harm physical or mental health. This increase exposure to sexually transmitted infections. Also, sexual and reproductive health is essential to adolescent well-being. However, knowledge is often insufficient or poorly applied. Some risk behaviors may include substance use, inconsistent contraceptive use, and STI exposure. These infections remain a major global public health issue. Over 1 million STIs are acquired daily by adolescents and youth. This population account for 50% of new STA cases in the US. And in my country, Brazil reports 10 to 12 million STI cases annually. So the link between adolescence and these factors, and beside a neurodevelopment, influences risk decision making. So thinking about this group, this population, the university students are particularly vulnerable group. Although law supports sexual and reproductive rights, university needs focused strategies. This university life is often the first experience of autonomy and freedom. This environment should promote STI prevention and health education. The transition into higher education increased decision-making independence, and even with academic access to information, risk sexual practices remain frequent. Think about that. The exposure to new social experiences may lead to alcohol and drug use and unprotected sexual activity. Recent studies show to us that this population have low perceived vulnerability to STIs inconsistent condom use as well, and delays in seeking testing and treatment. And this population, the attitudes and behaviors may increase the STI risks. So this justification and relevance of our study. The study aims to deepen the understanding of how sex education influences university students' behaviors related to STI prevention, contributing to scientific knowledge and guiding public policies and educational interventions. And also understand that sexually, gender, and health education helps build a knowledge base that addresses diversity, deconstructs taboos, and promotes health throughout all life stages. And the last one, despite access to formal education, many young people still lack sufficient knowledge about sexual health, exposing them to greater risks, especially during the transition of the adolescence to university life. So the research question of my project is, what is the relationship between young people's sex education and their knowledge, attitudes, and practices regarding STIs, considering the complexity of life changes, exposure to HRBs, and entry into university? And my thesis is based on the sexual knowledge gap among adolescents and young people contributes to their exposure to risks, including STIs. In addition, HRBs enhanced by the university environment can result in negative health outcomes for young people. So the objectives of our project, the main objective is to analyze the knowledge, attitudes, and practices of university students about sexually transmitted infections. The specific objectives are to investigate the level of knowledge about sexual health and STI in this population, to know the main agents and sources of prior education of this population, to understand the gaps in prior sex education of university students, and to apprehend the perceptions of university students about attitudes and practices related to sexual health and STIs. So the materials and methods of our study, the study design, we will conduct a convergent parallel mixed method based on the perspective of pragmatism. In this method, the collection of both data occurs at the same time, with the separate analysis and the subsequent merging of these data, highlighting the equivalence and importance of a quantitative and qualitative approach. This study will be conducted at the State University of Maringá, main campus, Brazil, in the first half of 2025. The participants will be young people enrolled in the courses at the main campus. The inclusion criteria, we will include students of all genders, first years students entering higher education 2025, enrolled in face-to-face courses, and aged between 17 and 24 years. We choose including the adolescents with 17 years because they enter early in university. The exclusion criteria, we will exclude students with a previous degree completed or not, students repeating the first year, and students who are pregnant or already have children because the information in prenatal. The estimated sample of our study, there are around 3,000 first-year students across 40 courses in morning, afternoon, or evening classes. In here, I made a fluxogram adapted for Creswell and Clark. And in the first step, we choose the research questions of both approach. In quantitative nature, the questions are, what is the level of knowledge about STIs among university students? And what are the attitudes and practices related to STI and sexual health in this population? And the qualitative question guiding is tell me about your knowledge regarding sexual health and STIs, and some supporting questions to use in our interview. Still in the first step, the data collection of quantitative nature started in April to in August 2025. We made some questionnaires in Google Form, content sociodemographic, behavior, and sexual variables, and two validated tools, KeyAP from Brazil 2013 and STDQQ, adapted and translated to Portuguese 2019. This questionnaire and self-administrated is available on link or QR code in posters and pamphlets. The data collection of qualitative nature will occur in June to August 2025. The initial requirement through a questionnaire in the first approach, like I say, we will conduct individual interviews combined with snow sampling. The first participant who accepted to participate the interview will be encouraged to refer others university colleagues. The interview content may include topics like prior sex education, sexual initiation, risk behaviors, and knowledge of STIs. Will occur in private university location with duration of 40 to 60 minutes. The data analysis of quantitative nature, we use Microsoft Excel to organize the personal information in questionnaire scores using descriptive statistics. We use inferential statistics by R software, and also use the person chi-square test, ANOVA, and Poisson regression. The knowledge will be classified by these criteria: insufficiency, less than or equal than 50% correct answers, intermediate equal 50% correct answers, insufficiency greater than 75% correct answers. The data analysis of qualitative nature, the interviews will be fully transcribed on the same day of collection. We hope to that. Birding's content analysis will guide the interpretation, and we also use the software NVivo to data organization and analysis of this data. The third step will merging the two data sets to relate quantitative and qualitative data to understand the main objective of this study. And the last one, we will interpret the merging of these results to discuss the relationship between the two types of data in order to converge and produce a more robust understanding of this subject. The ethical aspects. This study complies with the ethical standards outlined in Resolution number 4066 of the National Health Council. The participants will be identified using alphanumeric codes, starting with the letter U, and followed by the teaching center abbreviation like CCS, for example, and a sequential number. This project was approved by the Human Research Ethics Committee of the State University of Maringá and received the official authorization from the Dean of UEM. This slide shows our timeline activities. In the phase 1, I made extensive and critical literature review based on scoping review, with completion of the research project and submission of the project to the UEM Research Ethics Committee, like I said in the last slide. The phase 2, I was approved in general qualifying exam with the development and improvement of our data collection instruments, and we conducted a pilot study to testing of instruments. In phase 3, it's my current phase. I'm collecting data, quantitative and qualitative nature, and organization and preparation of data set. The phase 4, we will to analyze the quantitative and qualitative data and the execution of sandwich doctorate, I hope. The last one, phase 5, we will occur the construction of scientific manuscripts, submission to journals, and scientific dissemination, and the final defense of the doctoral thesis. This is our posters and pamphlets that we put on walls and noticia boards and give from the students. And there is the QR code to access the questionnaire. And the last one, the expected outcomes. We expected access to level of knowledge university students have about sexual health, understand how knowledge influences sexual behavior and the incidence of STIs among this population, correlate these gaps with the prevalence of sexual behaviors, measure the specific knowledge regarding the prevention, transmission, and treatment of these infections, understand the students' vulnerabilities in sexual development, supporting the development of target educational strategies and interventions, and contribute to reducing STI incidence and promoting healthier sexual practice among this population. So this is my references. I want to thank you again for this opportunity. Feel free to add questions, comments, or appointments. This is my email, and thank you so much.
Great, thanks, Beatrice. Let's see if anybody has any questions, comments, suggestions, please